Hi, my name is Chris Good, and I'm a spine surgeon at the Virginia Spine Institute. I'm going to be explaining to you about the diagnosis of an annular tear. So an annular tear is an extremely common condition that happens in the spine and can cause back pain. In order to really understand what it is, I think we just need to talk a little bit about how the spine works in the anatomy, and then we'll get into the details. So if we look at the spine goes from the base of the head all the way to the pelvis, and it's a series of bones and discs that are stacked together, one on top of another. These all move in relation to each other, kind of like cars on a roller coaster. So as we live our lives, there's always motion across our discs as we bend and twist and we move. Now, the brain turns into the spinal cord, which is running inside the spine. The spinal cord comes down to about here, and in the low back, we have little nerves running inside the spine, just like cables in a conduit pipe. Okay? Now, if we look at the disc is actually two components. And if we look at a cross-sectional view, there's a hard outer lining to the disc, and then there's a softer material inside. So the outer lining, think of that as like the radial tire. That's called the annulus fibrosus. And then the inner disc material is called the nucleus pulposus. I know, I didn't make up the names. Now, the annulus is the outer lining of the disc. And as we live our lives and we move, we put stress across the disc. And different positions we put our body in can put pressure on the disc and the other structures in the spine. So an annular tear is an extremely common condition where someone develops a tear across the outer lining of the disc. Now, when people develop an annular tear, it can cause extreme pain, usually severe back pain. And it can be very frustrating because a little tear, you're thinking you have a hangnail in there, can absolutely cause inflammation and lock up all the muscles in the back. And so I see people who have annular tears and they come in with 10 out of 10 pain. Their family members are helping them get in the door. They're twisted like this. They can't stand up. Now, the good news is that most people who have annular tears, even with severe pain, the pain typically goes away relatively quickly. If we can use medicines to calm down the inflammation that the annular tear caused, and physical therapy to calm down the muscle spasm and restore normal motion of the back, most people who have annular tears get through them relatively quickly and get back to a normal, healthy life. Now, I just want to show you an MRI scan. This is an MRI scan, and what we're looking at is a high-resolution picture looking directly into the low back, so a side view of the spine, and we can see the bone and the disc and the bone. They're stacked one on top of another. This is a healthy-appearing disc which has a nice, smooth outer border. Okay, this dark lining here and here is the annulus fibrosus, and then inside here, this white area, that's the nucleus pulposus. Now, this is an example of an annular tear, and we can see this white line. That's actually a tear across the outer lining of the disc. So a tear across the annulus fibrosus we call an annular tear. Now, for people who have this, typically we're able to get them through it quickly. Unfortunately, there are some people where this annular tear will start them down a cascade where the disc is destabilized and continues to degenerate more and more. Luckily, most people we see with this, we know we're going to be able to get them their symptoms to calm down and get them feeling better. For the people who this starts off a process of other disc problems, then there's a host of other treatments that can be explored, but luckily for most people we see with this, we don't really need to get into it at that level.